Good morning. I'm Dr. Gil Wilshire, your fertility insider. Today's obviously a surgery day. Today we're going to be operating on an enormous uterine fibroid. Fibroids are very common tumors of the uterus. Your average Caucasian woman might have up to a 40% chance of having a significant fibroid in her lifetime. Women of African origin can have up to a 70% chance of having a significant fibroid in her lifetime. So obviously this is a very, very common problem. They tend to grow as women get older, but occasionally we see them in young women as well. Today's patient is in her mid-20s, very young, very healthy, that has an enormous tumor in her pelvis. In GYN, we measure tumors as if the uterus were pregnant. This woman's tumor makes her uterus look as if it were 18 weeks pregnant, or essentially halfway through a pregnancy. These types of tumors really need to come out. They cause a lot of problems. They compress all the other organs in the pelvis, the bowels, the bladder, all these things have to have room to work. We like to do surgeries through tiny little holes, minimally invasive surgeries, but in this case we have to do an old-fashioned laparotomy. We're going to do our best to make this a bikini cut, so she looks real pretty after the surgery. But this could be a big bikini cut because it's a big surgery, big tumor. This woman has antibiotics on board. There's a small but decent chance of blood loss, so we have blood typed and crossed and ready to go. And the OR is all prepared for any eventuality. So we're going to go ahead and get this done. My incredibly experienced, lovely assistant Kim will be right across the table from me, giving me help and guidance. As I've said before, surgery is a team effort and requires an excellent team to get it done right. So, let's go get her done. We'll talk afterwards and talk about what we found. Thanks for your attention.